Teeth cleaning and gum healing treatment. How tartar buildup damages your personality. Foul smell makes people avoid close conversation. Bad teeth appearance creates a poor first impression. Yellow smile reduces attractiveness instantly. Negative social perception, people may judge silently. What is teeth cleaning or scaling? Teeth cleaning or scaling is non-surgical painless treatment which involves removal of dental plaque and tartar from teeth with the intention of preventing and inhibiting future cavities, gum diseases, and periodontal problems. How frequently should teeth cleaning be done? Teeth cleaning or scaling should be done in every 6 months, enables the dentist to examine the mouth and guides to follow proper oral health regime. Why is teeth cleaning required? If tartar is not removed, it progresses from plaque buildup to gingivitis, then periodontitis, leading to bone loss and eventual tooth loss. Mild neglect early stage, plaque hardens into tartar and cannot be removed by brushing. Bad breath starts, gums become red, swollen, bleeding while brushing or flossing. Continued neglect moderate stage, tartar spreads below gum line, gum recession and teeth appear longer, formation of periodontal gum pockets, persistent bad breath. Severe damage advanced stage, bone supporting teeth starts dissolving, teeth become loose and mobile, pain while chewing, pus discharge from gums, eventual tooth loss. When is professional teeth cleaning absolutely necessary? Oral prophylaxis plays pivotal role in one's health, and it has been recognized that oral infection may affect the course and pathogenesis of number of systemic diseases such as diabetes, commonly known as sugar. Increase in blood sugar level causes a state of hyperglycemia, reducing body's response to infection, ultimately causing bad breath, bone loss, and gum diseases like swollen and bleeding gums, along with altered taste. Heart diseases, the bacteria in mouth may migrate to inner lining of heart valves or chamber or spread through bloodstream, clogging the arterial walls, leading to bacterial endocarditis and other cardiovascular diseases. Dental experts suggest full mouth oral prophylaxis before and after the surgery to minimize the complication due to oral health into developing systemic diseases. Pregnancy and birth complications. Pregnancy is most beautiful phase of women's life, but it has enormous hormones fluctuation. Ignorance with the oral health may cause increased risk to tooth decay and gum problems, as periodontitis is directly linked to low birth weight child and premature birth. HIV or AIDS. HIV attacks the body's defense system, especially the CD4 cells, and when their count falls below 200, risk of multiple infections increases. This can lead to oral conditions such as candidiasis, oral hairy leukoplakia, necrotizing ulcerative gingivitis, and Kaposi sarcoma. Maintaining good oral hygiene and regular dental visits plays an important role in preventing these complications. Cancer and its treatment can weaken the immune response, causing the dry mouth, burning sensation, and thereby makes oral cavity prone to many infections. So visiting dentist for oral prophylaxis before and after treatment can minimize such problems. How dentists perform teeth cleaning or gum cleaning. Teeth scaling can be performed by two in-clinic methods: manual traditional method, use of hand instruments; machine, ultrasonic units, painless and non-invasive method for removal of rigid calculus and stains. After the teeth cleaning procedure, teeth polishing is done to maintain the smooth and shiny surface of the tooth. An irregular surface promotes staining from food. Pros and cons of dental cleaning. Advantages of teeth cleaning: removal of plaque and tartar, elimination of bad breath, prevention of tooth decay and tooth loss, prevention of bone loss, radiant and bright smile, reduced risk of systemic diseases related to oral health, long life of dental implants. Disadvantages of teeth cleaning. No known disadvantages, but a few myths of teeth cleaning. Myths and facts. Myth: teeth cleaning is painful. Fact: it is a non-surgical, non-aggressive, and non-invasive procedure, so it's completely painless. Myth: teeth cleaning abrades the tooth surface, weaken the tooth, and loosen the fact. Scaling is important for teeth. It removes tartar, and as it removes gum problems, bad breath, and yellow teeth. Along with it, it prevents loss of bone due to calculus and plaque deposits. In fact, it strengthens the teeth instead of making them weak. What is deep cleaning or gum surgery? It is also known as gum therapy, as it eliminates the bacteria, tartar, and food debris in between the root and gums, and refines the root surface to maintain the biological adherence of gums to the tooth, and treats the gum diseases like gingivitis and periodontitis. It is performed to address regrowth of tissue and bone, elimination of periodontal pockets, and bacterial growth in gingival crevices. lessening gum gaps between teeth. Points to consider before choosing a dentist for teeth cleaning or gum surgery procedure. Many clinics often claim to have ultra-modern technology. Please do not rely them right away. Instead, kindly check whether the equipment they use are a world-renowned brand or substandard. Choose periodontist surgeon who has received specialized degree to perform gum surgery. Use of laser for painless surgery, bloodless surgery, and fast healing. Use of conscious sedation to relieve anxiety. Painless injection system to make whole procedure pain-free. Why choose Teeth Care Center Dental Hospital for teeth cleaning? Teeth Care Center Dental Hospital has highly skilled and experienced dental professionals and specialized gums. Specialist periodontist who focuses on ensuring optimal oral health and achieving desired results. We strictly abide the sterilization protocol, the 7-step ADA and CDC guidelines followed to prevent the contamination and maintenance of hygiene. Piezoelectric ultrasonic unit at Teeth Care Center Dental Hospital. Your comfort and safety are our priority. We use an advanced ultrasonic cleaning system called the P5 Neutron Axis LED, developed in France. This device works using piezoelectric technology, which produces controlled ultrasonic vibrations with precise linear tip movement. This allows effective removal of plaque and calculus while being gentle on teeth and gums. Compared to conventional ultrasonic scalers, it produces less vibration and less noise, making the procedure more comfortable and less stressful for patients. Overall, this method is painless, minimally invasive, and tissue conserving, helping maintain healthy gums. With a wide range of specialized tips, it can be used for various dental cleaning and periodontal procedures. Dental laser, we use the BioLaser Epic X, a high-quality diode laser system from the USA. This laser works at a specific wavelength that targets soft tissues precisely, allowing minimally invasive, pain-free, bloodless, and often suture-less procedures. It is especially beneficial for patients who are anxious about traditional surgical methods. Compared to conventional techniques and other laser units, it provides better precision, superior bleeding control, minimal tissue damage, and faster healing with reduced discomfort. Hand instruments, we use Friday US, a based hand instruments made from finest stainless steel and meticulously crafted for superior performance and well known for its precision and working efficiency in removal of subgingival calculus where ultrasonic units are not accessible. Polishing unit, we use advanced air polishing technology with the Air & Go Easy from France to enhance cleanliness and appearance of your teeth. This system works on the principle of air, powder, water jet technology, which delivers a controlled stream of fine particles to effectively remove surface stains, plaque, and biofilm. It provides a smooth and polished tooth surface, making teeth look cleaner, shinier, and bright. It is also safe and effective for cleaning around titanium and ceramic implants without damaging their surfaces. Compared to traditional polishing methods, this technology offers better cleaning efficiency, improved access, gentle action on teeth and gum, and enhanced patient comfort. Contact us, Teeth Care Center Dental Hospital, 2nd floor, Pushback 66, near Samshwar Jain Temple, 132 feet Ring Road, Satellite, Ahmedabad, India 380015. Call +9 1787 878 3384 +9 1937 778 3384 www.teethcarecenter.com.